Are you in constant pain? Has your doctor prescribed pain medication? Do you need to know if there are truly effective alternatives to drugs? If so, this video is for you. Let's talk about research-based proven methods that are effective alternatives for managing pain, particularly chronic pain, in comparison to pain medications, which offer temporary relief and are often accompanied by undesirable side effects and the danger of dependency. Physical therapy approaches pain management from the root. It works on the body's own mechanics to not only reduce pain, but also improve overall functionality, offering a wholesome path to recovery. The following video will delve deeper into physical medicine, comparing its benefits with the drawbacks of chemical medicine. We are going to highlight the most recent research evidence and share real-life experiences that demonstrate how PT is often overlooked as the first pathway to treat pain. As a physical therapist myself, I am an expert in understanding body movement and employ this knowledge daily to treat my patients. We can treat a myriad of conditions, including but not limited to arthritis, fibromyalgia, brains, fractures, and post-surgical rehabilitation. Physical therapy employs several specialized modalities like dry needling, active release techniques, myofascial release, rice therapy, and deep friction massage. These therapies are specifically designed to reduce and manage chronic pain. Here is a brief overview. First up, we have something called dry needling. Imagine your muscles having small trigger points that cause pain and stiffness. Dry needling is like hitting a bullseye on a dartboard, but here we're using thin needles instead of darts to target these points. It's very helpful in easing muscle pain and stiffness, and is also helpful in improving your flexibility. Next, we have something called ART, short for active release techniques. Think of this as a spa for your soft tissues. With repetitive use, your tissues can get overloaded and develop something like knots, scientifically known as fibrosis or adhesions. ART focuses on smoothing out these knots, which in turn helps to ease tissue tension. Then there's myofascial release, a hands-on technique that feels as good as it sounds. This is about gently applying sustained pressure into your myofascial connective tissue restrictions. It's like ironing out the wrinkles in a shirt, but in your body. These wrinkles are pain and motion restrictions, and we're using pressure to smooth them out. You might have heard of our next technique, the good old RICE method: rest, ice, compression, and elevation. Picture it as the trusty first aid kit for injuries, helping reduce swelling and pain. Finally, we have the deep friction massage. This isn't your typical day at the spa kind of massage. It's more like a deep dive into specific points in your muscles. It applies pressure to these points, which helps reduce pain and improves movement. Some more traditional methods also include ultrasound and electrical stimulation. These modalities can only be administered by a licensed professional and are administered according to each patient's unique needs and health goals, making these modalities highly individualized for everyone's specific needs. Pain medication, despite being effective in providing temporary relief, carries a significant drawback, especially with long-term use. The side effects can be as minor as nausea or constipation, or as severe as dependency and even an overdose. The recent opioid crisis has highlighted the inherent dangers associated with the long-term use of pain medications. Pain medications only address the symptoms and not the root cause of the pain, making them a short-term solution at best. In contrast, physical therapy offers a healthier, safer alternative to pain medications. It focuses on addressing the root cause of pain, improving the body's function, and reducing dependency on medication. It may require patience and hard work, but the benefits far outweigh these challenges. Physical therapy is being offered more and more often as the recommended first line of treatment, reducing the need for pain medications significantly, or even eliminating the need for them entirely. Please don't take my word here. Let the research speak for itself. The following 3 articles provide strong evidence for the effectiveness of physical therapy in pain management and reducing dependency on medication. The first study is called "Early Physical Therapy Can Reduce the Risk of Long-Term Opioid Use." This study is based on insurance claims data from over 88,000 patients, found that early physical therapy reduced the risk of long-term opioid use by 10%, particularly among patients with knee, shoulder, neck, and back pain. Additionally, the study found that early physical therapy resulted in decreased opioid medication use by patients. The second study entitled Physical Therapy as the First Point of Care to Treat Low Back Pain. According to this study, seeing a physical therapist as the first point of care for low back pain resulted in 89% lower probability of needing an opioid prescription, 28% lower probability of needing advanced imaging services, and 15% lower probability of making an emergency department visit. Finally, the third study, trying physical therapy, first for low back pain, may curb use of opioids. This study brought to light another significant observation. Starting physical therapy as a first-line treatment could potentially curb the use of opioids for managing low back pain. This study examined data from over 150,000 patients. The findings suggest that patients who tried physical therapy first had lower healthcare utilization, reduced opioid prescriptions, and hence lower healthcare costs. It stands as evidence that physical therapy could be both a cost-effective and health-conscious strategy for managing low back pain. There are dozens of case studies that provide compelling evidence for the effectiveness of physical therapy. The following is a representative example of a typical case studies. A 45-year-old office worker. John began experiencing chronic lower back pain, making it difficult for him to sit for extended periods. His physician recommended pain medication to manage the pain, but John was wary of the side effects and dependency. Instead, he opted for physical therapy. His physical therapist designed a personalized program for him that included strength exercises, manual therapy, and specialized modalities like dry needling. Within several weeks of adhering to this program, John's pain decreased significantly, and he was able to return to his daily activities without the need for pain medication. Overall, physical therapy offers a promising and safer alternative to pain medication. As our understanding of pain and its management continues to evolve, physical therapy is likely to play an increasingly important role in healthcare. It offers a more sustainable and holistic approach to managing pain, improving function, and enhancing quality of life, all while minimizing the need for medication. The research clearly points towards the benefits of early physical therapy intervention in managing pain and reducing the need for long-term opioid use. As healthcare providers and patients alike become more aware of these benefits, it is likely that physical therapy will become a more integral part of pain management strategies. Physical therapy is a long-term solution that requires time, effort, and patience, but the results are worth it. It's time to shift the narrative from quick fixes and temporary relief to long-term solutions and improved quality of life. As always, before beginning any new treatment, it's crucial to discuss it with your healthcare provider and make sure it's the right fit for you. This wraps up today's topic on physical therapy versus pain medication. I leave you with this thought. Your pain is temporary, but the strength you gain from it is everlasting. If you find this information helpful, please hit the like button and subscribe to our channel for more health-related content. Thank you for joining us today.